piriformis muscle and the muscles in the back pocket area can be troublemakers and often become tight, burny, nagging, and angry. The tissues here are very deep and heavily layered, so we want to pull out our bigger guns for this one, the cups that have a stronger suction. So what I like to do is put the client in supine with the leg that I'm treating in a bent position before we start, and the opposite leg resting on the table in neutral. Then we're going to take the hip that we are working on that's in that slightly bent position, and we're going to put that back pocket region in a stretch position by flexing the hip, adducting the hip, and externally rotating. So we're going to flex the hip, we're going to adduct the hip, and then we're going to give it a little bit of external rotation. From here, we can have our client support and maintain that stretch by just holding onto the knee and or ankle. Perfect. And then we are going to blanket cup that entire area. I'm going to use a combination of the grips cups and the larger edge cups. So we could easily apply a few cups at the hamstring as well while she's in this position. After that area is blanketed, we can now take over and passively stretch that area with the cups already applied. So she can relax her hands. I'm going to give her a bit more stretch. And I'm going to hold here for about 20 seconds or so. And then I'm going to bring her back just in a nice resting position. I can keep the foot on the opposite leg, but just taking the stretch off of that back pocket region, and I can support her knee, and then I can go right back into the stretch. So it depends on the client, but I can hold these stretches for longer. I can shorten these stretches. It depends on my actual treatment goals. So after we've held the stretch, then we're going to ease off and allow that area a little break, a little reprieve. You can place them with their foot on the table or the foot on the opposite leg. Just hold and support the limb for about 20 seconds or so, and then I can go right back into another stretch. I usually stretch about 3 to 5 times. Sometimes I like to add a muscle energy technique. So from this position, after I've stretched her, I can have her actively attempt to bring the leg back down toward the table with about 30% of your actual strength. So I'm going to brace her and have her attempt to bring your leg back to the table until I say stop. Good, keep going, and stop. About 5 seconds with that manual resistance, and after she relaxes, I'm going to wait about 2 seconds. I'm going to have her relax, and then I'm going to take her further into that stretch. We can do that about 5 times. We'll do it one more time. So bring your leg back toward the table. I'm resisting with everything that I have, and relax. We're going to give it about 2 seconds. That way the muscle is really, really relaxed. And then we're going to take her further into that hip adduction, flexion position, and even add that external rotation on. Make sure your client can tolerate that. Our client is pretty flexible and doesn't have a lot of pain, but you want to make sure that your client doesn't have enough pain that would aggravate the pain, and that they have a decent amount of range of motion and no issues once we get up into those higher degrees of hip flexion. Another one of my favorite treatments for piriformis syndrome or back pocket problems is to use the same positioning, except this time we are going to dynamically drive the cup around the muscles in order to vacuum out adhesions, release tight, restricted tissues, and just make that hip feel nice and loose. I love this position because it puts that back pocket region on stretch, and it helps us to get into those deeper fibers rather than addressing the more superficial fibers. So while she's in this position, I'm going to just doorknob that cup around. I can add a little bit of traction if I want to. I can add some tilting in different directions. I can add some whirligigging, but we're getting the stretch of that back pocket region while we're ironing out adhesions. I can do some straight line or some frictioning. Frictioning is usually really good for that back pocket region because it's a more aggressive stroke and it really targets those tight tissues. When I do my dynamic cupping, I like to use a size 3 or even 2 edge cup depending on the size of the person and the hip. We want the cup to be a decent size so we can drive it around, but not too big so that the suction is painful. I usually apply about 50 to 75% suction power, so the client is maintaining that back pocket stretch, and we are going to just drive that cup around, or I can maintain that stretch and I can drive the cup around. I like to go parallel and perpendicular to the muscle fibers, some frictioning in one direction. I can change and I can friction in a different direction. I can break suction, I can move the cup, I can change my techniques all along while I'm maintaining that hip in that stretch position. If I find a particular tight area, I may park the cup over that area and do a little decompression, a little tilting, and maybe even a little whirligigging just to give that area extra TLC. So play with these different techniques, play with the stretching, play with the angle of the hip. You can keep the hip in less than 90 degrees and do a little stretch. You can bring the hip above 90 degrees and now do a stretch and see how it feels. Check in with your client, ask them how it feels. Is one more intense? Does this feel better? But give all those a try right now.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.